Hi, good evening. Austin Mayor Steve Adler. You got a minute? It's Friday night, headed into the weekend. Not going to take too long. Do want to go over some of the numbers, touch real briefly on the vaccinations, and then weekend when we might see some protests here in town. Let's begin with the virus. And let's take a look at the initial dashboard. Let's see if I can handle the technology a little better tonight than in the past. Let's see how this looks. This is the initial dashboard. You can see the number down in the bottom left, 91 new admissions. The 7-day moving average is the 88 that is just above that. You can see in the color graph that's to the right, we're still in numbers well in excess of what we had in the spike in June, and the 91 is above the 7-day moving average. The 91 is down from the 103 that we had yesterday, and I'm encouraged that we're not having a second night in a row near 103. The 91 is more of a leveling off, closer to the 7-day moving average, but we seem to be bouncing back and forth. New cases today, the white numbers on the right-hand side, 690 new cases. That is above the 7-day moving average of 668, but relatively close to it. Yesterday's new case number was 1,108. And that was not a 2-day total. That's a really 1-day new case total. Obviously set records for us, 1,108. It's good to see us back down to 690 at this point. But again, the numbers just seem to be bouncing back and forth. But under any scenario, even under a good scenario, we are still above our 7-day moving average. The 16.2 in the bottom left-hand corner, which is our positivity rate, is a number that changes every week, changes on Tuesday. So that's the number that we saw last Tuesday and Wednesday when we were together. Let's go ahead and take a look at the second dashboard so we can take a look at the number of hospitalizations and ICUs. The total number of 2 cases, by the way, upper left-hand corner, took us up over 60,000 cases in our city. The deaths at 592 is an increase of 1 over yesterday. We had been looking at greater increases on a daily rate over the last several days. 1 is better than all of those, but even still, there's a family that is mourning tonight. The number of people hospitalized, 608. The 7-day moving average is 591. So hospitalizations over the 7-day moving average. The ICU count, 189, which is above the 7-day moving average of 184. Ventilators at 107 is right on top of the 7-day moving number. 189 is getting us precariously close to the 200 ICU beds that we said. The hospitals told us to plan that's when they would run out of the ability to have staffed ICU beds. We know that the state has provided us with some additional support and help for us and for the hospitals, so they're able to surge a little bit above 200. We don't know how long we'll have that help from the state, but it's helping us right now. We're appreciative of that assistance, but as a community, we have to pull down these numbers. As a community, we really do need to mask. Stay home if you can. Wear a mask if you're around anybody not in your family. Social distance, avoid groups. I mean, it's really that simple, and that's what we need people to be doing for us right now. Austin Public Health is getting out vaccines. You'll recall that we got 12,000 vaccines to get out. 600 of them went out last Saturday. at the Precinct 4, the vaccination event set up by Constable George Morales and County Judge Annie Brown. Got out about 630 vaccines. That left us about 11,400 vaccines that we had to get out this week. Things started pretty well at Delco and other locations where we're getting these out over in the east side of town. We got out, I think, about 900 on the first night. Improved practice, got out more than that the second day. The process has not been without its fits and starts and bumps. We know that there's been glitches with the system. In fact, on Tuesday, the system pretty much went down on us. We had about 4,000 people that were able to go online and actually get appointments. We had over 20,000 people that registered. I think we're over 50,000 people registered now. The system came back up. People were able to schedule times, but the glitch persisted. And on Thursday, the computer had 1,000 people all show up at exactly the same appointed time. We worked through that, worked through those folks, and the glitch was gone. I understand we still have a glitch with the resetting passwords. But in most all other respects, working well, moving people through. On Thursday, we were able to get almost 1,900 people through the center, and then in one of our centers in East Austin, the other one about 1,300, combined over 3,000 vaccines got out yesterday. Now, the vaccines that we're getting out, we're trying to lean into the 1B people. These are people that are over 65 or people that have significant comorbidities, health issues. If you go up to the Austin Public Health website, they'll ask health questions and age questions. If you are among the most vulnerable of the vulnerable, then you get an appointment set. Otherwise, you're told, thank you for registering and we'll get back to you. I'm getting calls from a lot of people who are over 65 that are anxious and want to know why it is they're going on the website and not able to get their vaccine. After all, they are over 65. The numbers that we have in this city, we have over 200,000 people in our city that qualify as 1B. I think it might actually be over 220,000 that qualify as 1B. The truth is that we just do not have enough supply coming from the state in order to be able to get it out to everybody that we would like to get it to. We don't know how many doses we're going to get from the state. They're the ones that decide how much somebody gets and who gets it. Certainly, we're asking for as much as we can to get it out to as many as we can. We've asked for a demographic report so we can see exactly the demographics, age, race, ethnicity of the people that are getting the vaccines. And we should be getting that report here shortly. Right now, we're just trying to get as many people vaccinated as we can and file the reports with the state that we're required to file. Based on the performance and then the number of vaccines that we're getting out, the state went ahead and gave us our allocation for next week, and they gave us another 12,000 allocations. We immediately put that into our system and started increasing our capacity to get out the vaccine, so we're not waiting to next week. It was anticipated that some of that vaccine may be getting out to people today. Certainly, some of that vaccine will be getting out to people tomorrow. I know that no system is perfect, and that there are people that are signing up and getting in that are people that might be fully insured. as opposed to people that don't have insurance or are underinsured. We have a system that's set up in Texas, and by the rules with the state, anyone in the state is allowed to go on to Austin Public Health site and go through the registration process, which means, incidentally, if you want to sign up to take a test, get a vaccine in Dallas or Houston, you have the ability to do that. So anybody anywhere in this state can sign up if they can get through to get a vaccination anywhere else. Things are actually working here more smoothly than they are many other places. I was reading in the newspaper the judge and the mayor up in Dallas seem to be going at it each other in public. That's unfortunate. Hopefully they can work that out. We had a lot of people that showed up on the very first day that were given the vaccine because they had waited in line. That was obviously something that wasn't going to work if we were going to be able to vaccinate all the people that had appointments. So we stopped doing that on Tuesday. Still have people showing up without appointments, even waiting in line, figuring that if they wait in the line, when they get up to the front, they'll get the vaccine. Not the case. If you don't have an appointment, you really shouldn't go, shouldn't be crowding out people, shouldn't be increasing the number of people that are in the lines. We're going to continue to try and get out as quickly as we can the vaccines that come to us from the state. Now, we don't control, we don't know how many vaccines the state actually has. We don't know, we don't control whether they're going to be giving vaccines to other places here in Travis County. We don't know the answer to that. What we were originally told is that other people would still get supply as well. And the more that anybody gave out, the more vaccines that we would get. Again, we don't know how many the state has or whether they're going to give it out over time. We just know that they gave us yesterday 12,000 more for next week. And even before this week's over, we should be getting that into people's arms. I know that the new president elect has indicated through his people that he's going to push out a lot more of the vaccine. Apparently, at the federal government, they've been holding back some of it for second shots and the like, and they've indicated they're going to get the vaccine out as quickly as they can. That may increase the supply of vaccine that can be distributed. We hope so. And I joined 30 some odd other mayors of our largest cities in the country, asking the administration to get out as many as they possibly can, as quickly as they can, and to give it to the cities so that we could get that out as best we can to the people that need it the most in the areas where those folks live. But we're going to continue on with that effort. Let me see here. We're going to continue to work on the technical issues in the sign-up process that arise because of the incredible demand that we have. The system will get better and better over time. It's getting better. We are just at the early stages of getting this vaccine out. It's going to take a while before it gets out, just because of the limited supply that we are getting. We have 1 million people to vaccinate here in Travis County. As I said before, almost a quarter of those people qualify as 1B. So there are a lot of people that are eligible right now that are not able to get the vaccine, and we just need everybody to be as patient as they can and protect themselves as best they can while they get the vaccine. If you get the vaccine, know that you are not immediately inoculated, or you're inoculated, but immediately out of danger from getting the virus. It can take a couple weeks before the resistance builds. And remember, it's not 100% perfect. So you can get the vaccine, even if it's 97% effective. That means it's not going to be effective for 3% of the people, which is why, even if you get the vaccine, you still need to wear your mask. still need to social distance, do all the rules until more and more people are also vaccinated. I'm going to conclude by talking a little bit about demonstrations. We have some generalized threats and indications of demonstrations this weekend on the 17th and through the inauguration. Nothing specific targeted for us, but heightened alert. DPS and Austin Police Department, I believe and have faith, are going to be up to the challenge and ready for whatever it is that might happen, if anything happens. And we just don't know. I know that they are visiting and with each other and planning together. I've had the opportunity to be briefed directly by Chief Manley, and I believe we are in a good position. Obviously, we've dealt with demonstrations before, but what we just saw happen in Washington was something that was pretty unique. This was demonstrators that were doing different kind of demonstrating, folks that were designed and had as their design to take over a building, people that were showing greater expertise than you would normally find in a protest or demonstration. And it is that kind of thing that our police and the DPS are on the lookout for. I would suggest to everybody that if you don't have a reason to come downtown when and if demonstrations are happening, that you just avoid downtown. Sometimes it's best just to ignore and not bring attention to certain things that might be happening in the city. And I think that's something that we need to consider this week. In addition to that, the virus, as we see, has uncontrolled spread at this point. ICU occupancy is still really high. So that's another reason why, even this weekend and leading up to the inauguration, it would be best if you stayed at home. With that, it's Friday. We'll be heading into the weekend. We'll continue to watch the numbers. I don't know whether there'll be a got a minute on Monday night or not. It's a holiday. If there's something significant that needs to be reporting, either in terms of numbers or vaccinations, or with respect to protests or demonstrations, then I'll certainly be back. Otherwise, you guys have a great weekend. Take care. Good night, and please be safe.